Thank you very much. Good morning, everybody. First and foremost, just to welcome you all here and to say that I always say when we have a stakeholder engagement in the European Parliament, we must always remember that it's your Parliament. It's here for a purpose, not just to legislate, but also to engage with stakeholders and those that have an interest in society or in a specific area. And of course, this morning, we're here as an interest group on brain health and neurological conditions, and we're trying to shape future policy and policy responses to rare neurological challenges. I suppose a small little bit of background. My name is Billy Kelleher. I'm an MEP from Ireland. We speak very fast, so I'll try and put on my mid-Atlantic accent, and hopefully everybody will be able to stay with me on this. But I was also the party spokesperson in Ireland for 7 years on health. And in that 7 years, I saw firsthand both as a member of the Irish Parliament, but also in my role as spokesperson on health for my party, the significant challenges that people with rare diseases face on a continual basis. There are many rare diseases, but by nature they are rare, but when you collectively add them together, they're quite significant in terms of population. Yet the advocacy behind it and the stakeholder engagement is not where it should be in terms of being in contact with the policymakers, both nationally and now at European level. We now have an opportunity. We're talking about developing a European Health Union. Commissioner Verhali will be charged with that. And the concept grew out of how we dealt with the pandemic and the COVID crisis, both in terms of research, the vaccines themselves, the procurement, the distribution. And it was shown there that if you use our collective capacity in a positive way, pooling our resources, that we can do great things. And I think in the area of rare diseases, we need to do that as well, more so than any other area in the health sphere. No member states, particularly smaller member states, will have the population base, both in terms of patients, but also in terms of clinicians and infrastructural capacity to deal with every rare disease. So we have to, over a period of time, see how we can build on the European reference networks, how we can build out capacity and cooperation across Europe so that patients aren't left behind, as is the case, both in terms of diagnosis, late diagnosis, and then running through to not having the supports in place to deal with their neurological conditions and other rare diseases as well. So I think that's a critically important aspect. And as an MEP, Andre here is a new MEP as well. So I want to welcome Andre.
Thank you.
He's an expert in health as well. So it's good to have experts around the table as well when we are developing policy from a European Parliament perspective as well. So any additional supports that we get, we really do welcome. Just finally, the European Health Union and the Commission statements and the mission letters delivered to the various commissioners did not, in my view, acknowledge rare diseases at all. We have the cancer strategy, we have other elements, heart disease, cardiac diseases, but the rare diseases has fallen off. I'm very disappointed in that. I'm disappointed because for a number of reasons. First and foremost, because Europe, I think, has the capacity to coordinate member states to bring about greater care, greater solutions, but also in the areas of research and innovation. Mario Draghi spoke about research and innovation, Europe not being competitive, that we have to invest an awful lot more. And I think in the area of rare diseases, we need huge investment in the areas of research and development. And Europe can be a part of that. And then consequently, after research and development, we need to have proper reimbursement in place whereby patients can access medicines when approved. And it's still one of the most depressing sights to see members of parliaments across Europe, politicians, and they advocating outside of Parliament for a medicine to be made available or a therapy to be made available for a person with a rare disease that could be life transformative, life changing, and yet, you know, it might be approved in Germany but not approved in another country. And I think we have to get to a stage where once it's approved by the EMA from an efficacy point of view, that then reimbursement should be automatic. That would be my view, and I sincerely hope that we'll get towards that. And I met with Commissioner Verhali on the broader issues around the health union and discussed these issues. But look, enough said by me. I want to wish you well. There's a lot of stakeholders here. There's a lot of interest here. There's a lot of goodwill. Let's tap that goodwill and put it into a very focused effort to try and encourage the European Union to play a more meaningful leading role in developing a strategy around neurological rare diseases. Thank you very much. Best luck today. I'll now hand you over to the President of the European Federation of Neurological Associations, Astri Arnesen.
Thank you.
And you're very welcome.
Thank you so much.
And it was worth the wait.
Thank you. I'm so sorry for being late due to some accreditation issues, and they are strict here on who comes in, which is, I guess, is good. But so, Jess, thank you so much for your warm welcome and for your interesting and really positive and good words, MEP Kelleher. And thank you for being so kind to host this meeting, and welcome everyone in the room for waiting for us, and also you online out there. We have several people attending and looking at this being streamed. So that's also really appreciated. Because I was thinking in these times of so much political turmoil, I actually get even more respect and appreciation for the democratic system and infrastructure that is institutions that is put in place, and the role that we as NGOs play in terms of facilitating the dialogue between you, the politicians and policymakers and decision makers. So this is really in deep appreciation of us being able to be here together today and have this meeting and put these important topics on the agenda. So thank you again for that. And today, we have invited several people really with deep insights and experience in dealing with rare neurological conditions, either themselves or a close family member, but also people working in the space and playing an important role there, providing care and hopefully also therapies to as many people as possible. And we're also so happy and in deep appreciation of several MEPs showing interest for this meeting, and they will be here and give their, statements and points of views during this meeting. So we are really happy to see that there is the interest from you as politicians. We need you and you need us to be making the most wise decisions on how we can move the field forward. There are huge needs in the field of rare neurology, which is our topic. Actually, there are 400 different rare neurological conditions. And it's also said that around 75% of all rare diseases, being several thousand, maybe 6, 7, 8,000 diagnoses, have neurological implications or symptoms. So it affects a lot of people. And it's not itching on the skin we are talking about, it's serious stuff. So we need to do better, and we can do better. So I was asked to say a few housekeeping rules, and the first one, stick to time. So sorry for being the first one to break that rule, but anyway, we will try to come through, and we do have time to go through the agenda as we have planned for. And if I interrupt you when you present, it's not because I'm very rude, it's because I have respect for, we want to hear all of the voices here in the room. People have been traveling and taking a lot of effort to come here to share with them, to share with us their points of views. And then hopefully we will get some time for that nice little treat behind us here towards the end, and a little bit of networking also. So with that, I will hand over to my colleague and the Executive Director of EFNA, Orla Galvin, to present a little bit around the health technology assessment framework that's coming into place.
Thank you, Astri. Again, apologies for being late. Thank you, Billy Kelleher. But on an EU level, health doesn't have, recognises no borders, recognises no political party. We have people from close to 20 different EU countries here representing several different rare neurological conditions. On the point of the microphone, one more housekeeping piece is if you are speaking, please turn your microphone on, and when you're not speaking, please turn your microphone off. It will just help with the visual for people online. Today, ahead of Rare Disease Day, we want to talk about the call to action for rare neurological conditions. This call to action, you can check it out on the screen that's on display right now. There is a QR code, there is a link, and we want as many people as possible to sign this call to action. It's not a novel concept. It's based around two major initiatives that all European countries have signed up to, one being the Rare 2030 recommendations, and the second being the WHO's IGAP. So it's a 10-year intersectoral. So health, yes, you can say health is a national issue, if you like, but actually the WHO's intersectoral global action plan on epilepsy and other neurological conditions highlights the fact that it is really intersectoral, which means there are so many EU policies that can have a significant impact on the quality of life of the families affected by neurological conditions. Next slide, please, Tad. Something that we want to highlight because of the timeliness of this data and of changes in policy, I would like you to look at the screen, and in the box that's highlighted second from the right, we are looking at data of the rate of availability, so how many products are available in different EU countries, and time to availability. So we talk about a European Health Union. I'm going to show you that for rare conditions, for the non-oncology orphan medicines, that this is definitely not the case. In terms of all products that have been approved that should be accessible, it is, despite the fact that neurology tends to be the second most approved therapeutic area, access, talking about availability in terms of rate and time, is the worst out of any other breakdown. We have some slight improvement in the average number of days, so the time is slightly increasing, but I want you to keep those numbers in your mind. So 32% for the rate of availability and 530 days for the time to availability. Next slide, please. So on this graph, on the right-hand side of the graph, you don't want to be on the right-hand side. The right-hand side is the wrong side of the graph to be on. You can see the EU average highlighted there in grey. If you look at Germany, you can see out of a possible 47 products, there are only 40 available, not even the full spectrum. And we think Germany is absolutely perfect, but it is the gold standard. So we talk about 40 products being made available in Germany. If you look at the likes of Poland, Ireland, and full spectrum of Eastern European countries, on the right-hand side, which is the wrong side of the graph, we see less than 15 products available. Next slide, please. Again, when we think about the time to availability, the right-hand side is the wrong side of the graph. When you think about 530 being the number of days, so on your screen, you're talking about everything from France to the right-hand side. They're the worst. Everything from France to the left-hand side are in the better area. We see Germany, the average time for the majority of projects or products, which are the green dot. So it's high, but we see the blue line for time is low. Unfortunately, when we look to the right of the graph, we see 500, 600, 700 days. And again, this is not days, this is years, people, that we're talking about. The significant difference of a couple of months in Germany versus a number of years. That is the difference between life and death when you talk about chronic progressive conditions that are often the case for rare neurological conditions. Now, it is not the fault of the countries only, in the sense that the reimbursement processes at national level are an issue. I'm conscious that there could be some farmer representatives here. You also have a role to play. If the country does not, if the product is not submitted or filed in a country, they're not going to have access. But that comes back to another EU issue with respect to the cross-border directive, that we need to make sure that that legislation is accessible, that it's user-friendly. At the moment, our feedback from 21 different pan-European umbrella organizations is that we absolutely need to see a more united front in this regard. Next slide, please. So, bringing it back to HTA and what can we do? Why is this so timely? Well, actually, last month, we saw the beginning of the EU HTA regulation for cancer medicines and advanced therapeutic medicines come into effect. What does this mean? Well, it means the EU is coming up with solutions to increase the time, or to decrease the time, to increase the speed at which we get access to therapies. This is challenging for ATMPs, which tend to address neurological conditions. It's hard to be a first in kind, if you like. A lot of learnings will need to be made, but we also need to be careful that we get this done right. We need to think about things that are in the call to action in the Rare Neurology Charter, things like single arm studies. We need to think of making use of the natural history of conditions and using that as the control or reference point. For other products, such as orphan medicinal products, which are very broadly attributed to rare neurological conditions, we have some wriggle room. We have a little bit of time. We have 3 years, and the date is on the screen for January 2028. Now is the time that we need to be taking action across Europe to make sure that we get this right, that patients, clinicians are involved in this process. Our president, Astri Arnesen, is part of the EU Commission's Health Technology Assessment Stakeholder Forum. We're doing the best that we can, but we want to make sure that every country within the EU also is reflecting on these issues, reflecting on the points in the Rare Neurology Charter. Next slide, please. And again. So you can follow the website link to these points, but we need, as already mentioned, increased funding to support rare neurology research, more natural history studies, a multidisciplinary approach to neurological conditions. So again, intersectoral within the health system, but also access to disability cards, reimbursement or benefits for caregivers, taking a holistic approach. Moving on to the next half of the points. One of the major issues we have is stigma and discrimination and isolation for the neurology community, and even more so for rare neurology. So greater public awareness can address this. We'll have a presentation or an impact piece from a representative from the European reference networks here today, but we need these embedded in all countries within the EU. We need to take a good hard look at the orphan drug legislation, make sure it's suitable for rare neurological conditions, and to leverage, of course, the European health data space and make sure that we can realise the full potential of the EU pharma strategy. Next slide, please. So this is the last slide. So for those of you who are interested in HTA processes, EFNA has 2 tools. They're freely available. On the left-hand side of the screen, we have a report on patient involvement in HTA processes. And actually, my dear friend beside me, if I can call you a friend today, the best country that is prepared for the new rules and regulations in 2028 is the Czech Republic. Over a year ago, Jana Helvakova presented the HTA model in the Czech Republic, and it remains best in class, the gold standard. So I would encourage everyone to check that out. And we also have 2 learning modules on our TINA platform, freely available. Again, very suitable for national and EU level HTA regulation. So thank you very much.
Thank you very much, Orla. So obviously, development of therapies and access to those and the reimbursement procedures are crucial elements, but they are not the only one. So, so for this panel that we are now about to start, we will address what policies, because we're in the Parliament, this is where policy is being shaped and formed and agreed upon to a certain extent also. So what policies, where are the gaps, and how should they be addressed really to improve the situation for people living with a rare neurological condition? And to open that, we have invited our dear friend and colleague, Arabela Acalinei. Acalinei. Thank you so much for coming all the way from Romania to be here today. Yeah. And you're the president of the European Alliance of Neuromuscular Disorders Associations, but you also live with a rare neurological condition. Would you mind telling us a little bit about that?
Yeah, of course. I don't know. Is it working now? Okay. So my name is Arabela Acalinei. I come from Romania, and I do wear a lot of hats at European level because I'm, as you mentioned, president of European Alliance of Neuromuscular Disorders Associations, but I'm also strategic partnerships and funding director in the European CMT Federation. I'm a part of EURORDI's HTA task force. I'm patient advisory board in EuroNMD and working in several working groups. Board member of EFNA, yes. So, but I am in the end a patient with Charcot-Marie-Tooth disease myself, which is a rare neurological condition, but still one of the most common neuropathy, and that affects the peripheral nervous system. So I basically have some walking problems myself. And it's a burdening condition because it affects, it's usually, it is a genetic condition, so usually hereditary, and we are 3 generations in my family, my 2 sons included. It's not easy to live with such a disease because it affects your social life and a lot of fields in your life. Yeah. Yeah,
and where do you see what would be, beneficial? Where are the gaps in terms of how neuromuscular diseases maybe are addressed?
So speaking a little bit more broadly, I would say that diagnostic and the treatment are 2 steps of the same patient pathway, yet policies regulating them are often misaligned. This is what I could see. The fact that there are sometimes cases where treatments are available, but the patients do not get access to proper diagnostic. For example, like in Romania, we have all treatments for SMA, but the newborn screening is just a pilot. It's not yet well implemented. On the other hand, the other way around, like in CMT case, we are working hard to increase knowledge about CMT because it is a disease that can be very easily misdiagnosed or confused with some other conditions. So working with the European CMT Federation, we had last year a very ambitious 3 months awareness campaign where we try to reach out to professionals as well in order to make sure that they recognize the condition. But of course, it is a disease without a treatment. But the care is there, and the care to the patient, it's so different from, especially from Western to Eastern countries. There is a huge difference between countries. And this is something that it's really painful, because we do have, I'm also president of a Romanian association, and the people in my association are telling me, well, but why don't we have access to the same therapies, the same technologies like in Western countries? Well, it's something that I guess we need to address starting from here. Yeah. And then, yes.
I was thinking maybe you could elaborate a little bit. What are the consequences potentially for the delayed correct diagnosis?
Yeah, it depends on the condition, but there are some neuromuscular conditions where if you get a very late diagnosis, there is not much you can do about it. Like SMA, but SMA, things improved a little bit more. But still, I mean, all these delays in diagnostic are of course, burdening, and you see patients that are left behind, and they cannot contribute to the society. They cannot, and it's a pity that it still happens.
And for some groups, you actually cross a line where there is no options to treat, but there would have been if you had been diagnosed early.
Yes,
that's
exactly.
What you're saying.
So this gap and this misaligned, diagnostic and treatment, it's a huge problem, especially in Eastern countries.
So you mentioned now, access to diagnosis, the right diagnosis, and also the inequities in access to the therapies that actually is available in some countries. Are there other Any other points you would like to mention?
Well,
before we
just thinking, for example, about newborn screening, because EAMDA is going to focus more on newborn screening this year, and we plan to form a newborn screening coalition. This is a longer-term project, because we've seen the work that has been done through Newborn Screening Alliance on SMA, and we feel the need to enlarge it to other neuromuscular conditions. So our efforts will be directed in that direction of newborn screening. And this is also a huge problem, that there are even now states that don't have newborn screening for a lot of diseases. Like in Romania, we screen only for 3 diseases, and we have a pilot for SMA. That's all, which is not enough for sure. Because if we diagnose patients earlier, than the earliest the intervention, the better the care and the life of the patients in the end. Yeah. So yeah, I think the EU drug regulation doesn't address diagnostic, leaving it poorly regulated and underfunded, of course. So I think it is correct to say that we need to align diagnostic policies with treatment approval as well.
Thank you very much. So, Holm Dasna, I've had the pleasure of working with you as a patient representative in the network, European Reference Network, that you coordinate from TBIN, being for rare neurological conditions is our name of that network. And you've been doing that, and I think you have been really active also in actually establishing the network, also on the European level, as well as the German level. And we are really keen to hear your thoughts about where are the policy. Maybe I would like to hear about the successes as well, and then the hurdles and the challenges.
Yeah, so thank you so much. My name is Tom Gressner. I'm the coordinator of the European Reference Network for Rare Neurological Diseases. And I would like to begin by stating that it was really a visionary thing to establish the European Reference Network. So they are unique, they are globally unique, and it was really visionary by the European Commission and also by the European Parliament to actually establish them. And they are expertise networks of centers of expertise across the European Union, and they're really based on collaboration. So it's European collaboration doing something good for patients. And I think this needs to be emphasized. And it's really, I think also nowadays, this is really based on European collaboration. And what we see is that they really deliver. So they deliver in terms of care, they deliver in terms of cross-border healthcare, but also in terms of development of training programs for the next generation of experts. And they also deliver in terms of collecting data and information which can be used for programmed healthcare. I think where we have lack, and you also ask for the things which needs to be improved, we have, I think, two lacks. And one is integration into the national healthcare systems. So we focus now on those. So we have a rather large project on the integration of the RNs into the national healthcare system. It's called Jardin. And all member states actually participate, which is, again, a success, but the integration needs to happen. And the second thing I think which we need to develop, but we have our key places and our key building blocks in place, is research. And the MEP mentioned that in his introductory speech. So we have a very good basis in Europe to be very successful in terms of doing research and innovation in rare diseases. And the European reference networks are one of those building blocks. And we just need the respective investment. So I think just use what is in place.
So could you elaborate a little bit more on the what we need? I mean, we have the European reference network, so being clinics, being connected through that infrastructure, but then we need those being, I don't know how many in Germany, but there are quite a lot of clinics being members of some of the European reference networks. We have 24 in all, and I don't know, 4 or 5 of them covering neurological conditions, maybe even more. But how is that then translated into operating on the national level? Because that's where the patients are, isn't it? Can you say something about that?
Yeah, I can. Well, I think I would like to be very concrete and using things we've done in my European reference networks. And I start with diagnosis because diagnosis was also mentioned. So we develop diagnostic standards. These diagnostic standards then needs to be implemented, of course, on national and local level. But by doing so, and we monitor actually the implementation of those diagnostic standards, the time to diagnosis is reduced, less resources are being used, and then, of course, also these treatment gaps or mistreatments don't happen. That's one thing. The second thing I would like to mention is that we have established what we call treatment eligibility panels, and that's these are panels in which we combine the existing European expertise, so really all the clinicians which have expertise on a particular, and in this case, ultra-rare condition. And we have, based on the expertise, it's discussions as to whether a patient is really eligible for high cost and complex treatments. And this is a discussion, actually decision, which is very impactful for national healthcare systems because only the right patients receive then the right treatment. And in terms of for ultra-rare conditions, in particular ultra-rare genetic conditions, this is very often high-cost treatments, and I think also that is a topic which needs to be addressed. And maybe a third thing, and then I stop. And this third thing is really the development of structured training programs for the next generation of experts. So we have collaborated with the European Union of Medical Specialists, and we have developed what is called European Training Requirement. And this is a standard for the training of the new generation of experts. And we're now starting to use that for a postgraduate curriculum. And by actually implementing this kind of training program, we will be having experts not only on a European level, because that doesn't make sense. It's really on the local level and also on the national level to treat the patients educated by this or based on the standards we develop in the network.
Thank you. I think I need to rephrase just to make sure I understood you correctly. So in Germany, you have put in place panels where people can approach you if they have unsolved cases, so to speak, or cases they think have a rare condition, and then also to evaluate potential therapies. Yeah. Okay, so then I misunderstood you, because this is really important, because for ultra rare cases, you can only solve it and have experts on the European level because you can't have them in all the, I don't know how many countries we are. Yeah. So, but I want you to touch upon also how, because we need to have the country governments, the health authorities acknowledging the value of the networks and how we can really make that accessible to the patients out there, not necessarily even ultra rare, but still being covered by the networks. Can you say something about that before we give Jose the word?
I think you're asking for policy ask, and I think the very first, and for me and from my perspective, the most important policy ask is really to sustain the European reference networks. And that goes not only to the European Parliament, that also goes to the national governments, because we need both. We need support from the European Union and from the European Commission, but also from the national governments. And just to mention the elephant in the room in terms of funding. We have funding for the coordination on European level. That's fine. So we're working with that. But we don't have any funding for local hospitals for participation in the events, and that needs to change really, because it's on top. It's based on intrinsic motivation, and that's nothing that can be sustained. And I think the second thing in terms of policy ask is I also mentioned already, use the events also for research purposes, and also in particular for HTA things, so HTA purposes. And I believe that when we bring in clinical expertise very early in the HTA processes, then the results of those processes can be improved.
Thank you. Thank you for bringing in that element. It's really something I think a key to do best possible evaluations of efficacy and benefit for patients. Okay, I'll pass over to Jose Ángel Aibar from Spain. You have a son, I understand, with the Dravet syndrome, and you are also the president of European Dravet Syndrome Foundation, is that it?
Dravet Syndrome Foundation in Spain, actually.
So can you tell us a little bit about, well, so you can say a little bit more about who you are, but also about Dravet syndrome.
Yeah, indeed. So I'm the president of the Dravet Syndrome Foundation in Spain. It's a non-profit organization basically working on awareness, family support, and research. And I'm also a member of EPODIN, which is a great tool, not only for physicians, but also for patients. So yeah, I remember 11 years ago, my wife got pregnant. We were so happy. This is what we were expecting. And the delivery was okay. The delivery was fine. Our child, in his first month, he was meeting all the deadlines, all the milestones. So we were so happy. We are full of joy and happiness in the family. But I remember that day, you know, I live in France, and 14th of July, 2015, National Day in France, by the way. I was playing with my kid. He was 6 months and 4 days, actually. And he started shaking his legs and arms. We didn't know what's going on. I never saw a seizure before. I don't know if you here in the room have seen a seizure before. So we never saw a seizure before. And that was our how we got introduced to Dravet syndrome. So, you know, Dravet syndrome, it's a rare epilepsy. It's caused by a genetic mutation in the CN1A gene. 90% of the cases, the mutation is a de novo mutation, so not inherited from the parents, which was our case. And then the disease is really striking on the whole family. I usually say Dravet syndrome, it's a family syndrome, like many other rare neurological conditions. So actually, you know, my wife is sitting there in the back. She started her professional career here, actually, in Brussels, in the European Parliament as a lawyer, and now she's a full-time caregiver for our son. We have another son as well, but of course, Dravet syndrome comes with a range of challenges. It's a range of challenges, yeah.
Because it's not just the seizures, it's really they come with big consequences.
Yeah, indeed. You know, initially, Dravet syndrome is associated to febrile seizures in the first year of life, but then in the second year of life, they have to face a range of neurodevelopmental issues, so including cognitive delay, motor issues, speech issues, and even a 15 to 20% premature mortality rate. So yeah, Dravet syndrome, like I said before, it's impacting not only the patient living with the disease, but anyone in the family. And what we perceive sometimes is that physicians or the healthcare system is trying to address the issues associated to the patient, but not the issues associated to the whole family.
And where do you see the challenges and the opportunities in terms of shaping the future to be better?
Yeah, I think we have to keep increasing research funding. Now, there are many discussions around increasing funding on defense, which is of course needed, but we don't have to take that funding from research, which is what might happen. So we need to keep funding on research and education on rare diseases, and especially rare neurological diseases as well.
So more research.
More research, definitely. You know, Dravet syndrome, the etiology of Dravet syndrome is quite well characterized. It's caused by a mutation in the SCN1A gene, which causes a down-regulation in the sodium channels in the brain. So we know what we have to solve. We know what we have to target. And we have several programs actually in clinical trials trying to solve that issue, targeting the underlying cause of the disease. But for that, we have to keep increasing the funding of research. Billy Kelleher, he mentioned it at the beginning of the meeting, right? How research, how the global collaborative efforts help on the pandemic, developing several vaccines in a few months, which is something we never saw before. But we have to tackle as well all the issues associated to rare diseases.
Can I ask you, you have also been really engaged in the European reference network for rare neurological, epilepsies. Why? How do you see them as useful? You mentioned it initially.
Yeah, indeed. I mean, it's a platform to work together along with reference hospitals and physicians in Europe, which is also empowering the patient community. It's not only having discussions with key physicians across Europe, but also empowering the patient community. And we are, in our case, like in the case of many other patient organizations, we are providing a range of services to our patient community, which is not provided by for instance, the national healthcare system in Spain. So that's really empowers and give power to the patient community.
So you see them as a really crucial element in
definitely. I fully agree with Holm. ERNs also brings a very high value to the patient community.
Thank you so much to the panelists. Do you have anything you want to add that you've been thinking, oh, I should have been saying this? This is really a message I want to get through before we hand over to you, isn't it?
Yes.
Just a second. Do you have anything?
Sorry, just wanted to mention that indeed working in the ERNs is, it was, at least for me, an extraordinary experience, to see so much collaboration and the fact that the specialists there are very open to patients' voice. And it is a co-creation process in the end that's happening. But I really think that there is a huge need to strengthen the ERNs and their work by ensuring that their expertise translates into national healthcare systems. Because again, we see a lot of discrepancies between some countries, which is not okay.
Thank you so much.
Yes. It's just a question maybe, or maybe looking for support. Reference made by Arabela with regard to early diagnosis and the newborn screening testing system and disparities across member states. So Romania 3, Ireland 11, Italy is 54. Different types of tests or for genetic disorders and rare diseases. And I just think that it's an area where Europe, I can sense the previous commissioner was very supportive of the concept of having a European-wide gold-plated newborn screening testing system in place. And anywhere we can get support to campaign for that, I think would be something that would be a great benefit to those that are not yet born. And I really hope that that's something that we can progress. I sense there's a warmth in the Commission for this concept. Clearly there's going to be resistance from member states because it costs member states money, and everything that we discuss inside here, when it goes back to member states, you have a significant challenge. And that's why it's very hard to get health into a European competency, because it's such a big budget requirement in member states. But I certainly think in the newborn screening area, there's potential opportunity for us to have more streamlined European-wide benchmark of a high quality.
Thank you. Thank you for that comment. I think you mentioned defense. Yeah. So I think if Europe understands, we need to go together and really collaborate strongly to stay safe. It's the same for health.
Yeah, indeed.
And in particular for the rare disease.
I think we have to see how we can finish or end with all the inequities, the inequalities we have in access, right? Yeah. Today, your zip code defines the drugs, the services, and the treatment you have access to. So it's crazy. Your zip code determine your future.
Thank you so much. Now I hand over to you, and in fear of saying your name wrongly, I think I will not do.
My name. Sorry for it.
Thank you for being here.
Okay, I'm Ondřej Dostal, Ondřej actually, and it is my great pleasure to be here, dear colleagues. Thank you for having me. I'm a new member of European Parliament. I'm a member of ENVI and now SANT committee, but I was working for 20 years in health law practice and also in teaching about patient rights, about healthcare financing and organization. And I also had a few cases trying to get medical care from the Czech healthcare system to patients with multiple sclerosis or patients with SMA, and we were partly successful, partly of course not, because it is sometimes very hard from the grassroots level, as you of course know. It is my pleasure to work here with the patient groups and physicians also on the European level, not only the Czech Republic level. I myself founded also a platform of health insurance policyholders, which I say to stress the importance of the third leg in these two legs of public health system, not only patients and doctors, but also the taxpayers. And the taxpayers needs to receive value for the money they are paying in terms of health outcomes for the population, and for this HTA is of utmost value we need to promote. I would like also to thank Billy and Romana, and perhaps Tomislav will show up, for the possibility of cooperation across nations and political groups, which is necessary to achieve change. It is not possible to do on a party basis. I would like to speak for a short while about problems which I see in my healthcare system and also in other healthcare systems. There is always a big difference between formal entitlements in law and the real life outcomes, real life access for the patients. In my country, unfortunately, it begins with the primary care. Getting to any testing or screening requires to have a primary care doctor. But there are tens, even hundreds of thousands of people in Czech Republic, of 10 million people, who don't have a primary care doctor. So then any referral is impossible. And here the story begins, for instance, for parents who have a child, but do not have a family child doctor. So we need to concentrate on this. Another big problem, and I would go into a bigger detail, is reimbursement of medicines. Theoretically, we have a transparent process of getting a new expensive drug into the pharmaceutical reimbursement system. It includes patients, it includes HTA, but it is not all so sweet. Firstly, the policymakers hate to actually give the patients and doctor groups the formal right to appeal. So they come to the room at the Ministry of Health or the State Institute for Drug Control. They get ugly coffee, much worse than here. They can say what they want, but what is actually passed into the reimbursed system depends much more on actual talks between the pharmaceutical company and the health insurance company. And only these two have a formal right to go to court and say that something was wrong, which is bad. But it is they allow the policymakers to give the patients and the doctors the right to formally appeal something which is medical nonsense, which is wasting resources, which is bad. We tried it through courts. We were only partly successful, and hopefully the Transparency Directive on EU level can help a lot, but we need Commission support for this. Another problem is that a patient formally has a right to get the reimbursed medicine, but the real access depends much more whether the insurance companies actually create contracts, budgets for specialized centers. If you get a reimbursed drug, but there are no contracts, and then, well, nobody will provide it to you. So you need, as a patient, a lawyer who will sue the insurance company and ask the hospital to do it. And of course, you will not do it if you are sick. Who will do it? Family? Very hard. Who will do it? An expensive lawyer? Well, sometimes you don't have the money. So for this, patient groups are extremely important, and we need to support them. And I say it openly also with funds to help patients to defend their rights. So sorry for not being so optimistic, but it's like this. A few French notes. we need to promote prosperity, but because without prosperity we will have no taxes, and without taxes we will not have the public health system. This is obvious, so this goes across the EU policies. Yesterday we had here a person from Ministry of Health of Netherlands who told what was already told, that now everybody is speaking about competitiveness and defense. But in my opinion, a good functioning healthcare system is part of competitiveness, because the people, the workers, do not have to buy expensive private insurance. They do not have to save money. They can rely on having this from public, and therefore the labor cost is actually lower. This is why we can be more competitive than the United States, which do not have a functioning universal public health system. And concerning defense, we have to ask, what actually do we defend? What are the values? For myself, the public solidarity-based insurance system is actually a value I would be happy to fight for. Thank you very much.
Thank you so much for those remarks, and a really interesting ending there. What is it we are defending? And definitely universal good health for the population is one of those. So thank you so much. I will pass over then to the next panel. It's kind of a continuation of the same discussion, but you will also emphasize maybe a little bit more even the life course of these diseases being chronic, most of them, and many of them also, you know, degenerative and worsening over the course. Merete, Avery, you are actually a Norwegian colleague, which is really nice for me to have here around the table. It's not so often we are here together. But you are representing Dystonia Europe.
Yes.
And you also live with dystonia yourself.
Yes.
Can you share with us a little bit about what's that like?
Yes. Yeah, good morning, everybody, and thank you for having me here. I am Merete, and I have cervical dystonia. Dystonia is a chronic neurological movement disorder with muscle contractions and often repetitive uncontrollable movements. It can affect the entire body, but I have it in my neck. And I also have some dystonic tremor. I was diagnosed at the age of 45. It took a year for me to be diagnosed, and it took another year to get treatment. And I could not function at work, but with diagnosis and treatment, I work more than 50%. And the quality of life is also much better. Still today, we hear from dystonia patients, it can take 5 years, 10 years, 20 years, and more, unfortunately, to get a diagnosis. And this, of course, highly impacts the quality of life, as there is pain and also withdrawal, maybe from social activities. So also not knowing what's happening to the body, because it's kind of strange in a way when you cannot control your body. It's very stressful. For children affected by dystonia, the journey is similar, but often more, but also different, because due to the more severe symptoms. Normally, if you get it as a child, it can be quite severe, and also more of a development. Very often, parents struggle for quite some time before their child is diagnosed with dystonia. Their concern and worry of the child's symptoms might be dismissed with the excuse that the child will grow out of it, or that it's all in your head, meaning psychological. That is very typical what they are met with. The child might be misdiagnosed and told it's a functional neurological disorder or worse. Like I mentioned, it's just in your head or you will grow out of it. And without exploring genetic panels. DBS, which is deep brain stimulation, and you put electrodes into your brain with electrical stimulator attached to it, is quite an efficient treatment for dystonia, especially in the severe cases, and especially for many children who get dystonia. But if referrals are being made several years following onset of symptoms, meaning that orthopedic fixed contractures have already set in, so that is irreversible. Transition can be very challenging, as a lot of the pediatrics DBS patients are a new generation of patient for adult services that perhaps would not have previously survived. They pose new challenges for adult services in that they can be very complex with lots of medication. Mentally, both children and adults with dystonia experience emotionally distress, but adults often struggle with career disruption and social withdrawal, while children may face developmental and self-esteem challenges. As it's a lot of stigma within, it's a lot of stigma often associated with it. Therefore, my point is for this question, that knowledge and awareness among healthcare professionals is crucial for an early diagnosis, and access to treatment for both adults and children with dystonia for a better quality of life.
Thank you very much. I wonder, you're hitting something that is not just relevant for dystonia, but also for many other diseases. It's that you're not really believed, it's in your head. Why do you think that is happening?
I think if you have uncontrollable movements, this is just my opinion, but I think that many think that it's something also wrong with your mental health, unfortunately. It's sad, but that's what I think maybe. And also another thing that I just haven't heard about it before. I've also heard some doctors, I know one lady who now has 4 children after DBS. She got it when she was 11, and the doctor said she's just doing this herself. It's a psychological thing. So it's not known, it's not enough known, so therefore awareness.
And more experts understanding what this
Yes.
is about. Yes.
Yes,
Thank you.
we really want awareness among the general practitioners and other healthcare professionals to recognize that it's neurological, so you can be referred to a neurologist or a movement disorder specialist.
Yeah. Thank you so much. So over to you, Allard. You nodded, so I guess we are sharing, even though you represent a different disease called Myasthenia gravis.
Yes, thank you to be here. It's the second time. I was here 2 years ago as well, and I pleaded for MG patients at the time. I can but second what Arabela, Jose, and Merete said. Having a rare disease is difficult. It's not only a burden for the patient itself, but also the family. And especially with my case, I was misdiagnosed in the beginning, and they always, as Merete said, it's stress, it's burnout, it's because you're too busy, you're working, you're a young woman, you're working, you have 2 kids. And it seems at a certain time that women with a strange or rare disease are hysterical, but we are not. And that's one of the problems. It gives it a lot of difficulties. we can't anticipate, because when we wake up in the morning, we feel well, but an hour later, we can feel very bad. So we have to plan, but we can't plan. It's one of the burdens. And luckily, there are not too much young people with MG. Most people who got MG are young women during the fertile age, and rather elderly men, if I can speak of elderly at 55. And there are exceptions, of course. I know young men with MG. But it's a rare disease which is not known. And I agree with Merete, it's awareness and also education, and not only education from healthcare professionals, but also education for patients. Patients have to be more educated so they can advocate for themselves and say, no, I don't have a mental condition. I'm really physically ill. And that's what I did. And at a certain moment, my GP was angry with me because I didn't believe him. So I choose another one. I could do that at that time because I'm a patient for over 30 years now. But it takes me more than 1 year to find the right diagnosis. And we did a survey through Europe. And when we saw for MG, the period we need for women to have the right diagnosis is about 5.3 years. For men, it's only 1.8 years. So there is a big difference also because women got it when they are young and men when they are older. Maybe that's one of, but it's always the same. It gives us a lot of problems. The second point, it's invisible, which makes it even worse to explain to people. And I got the feeling I had to defend myself over and over and over again. And just yesterday, I told you, Astri, what I experienced. I came by train and I have difficulties to carry my suitcase and to put it on the train, get it off. And I asked the conductor, would you please help me to put it on the train? Oh, normally I can't do that. And my back is hurting. Okay, it's not a problem. I just have a neuromuscular disease. And then he took my suitcase, I put it on the train. So now, and I'm getting older, I can live with it. But when I was younger, I didn't dare to ask people to help me. And that's difficult for young people. They will start their family, they can't, because they are afraid. Can I have a child with MG? How will I be afterwards? Will I keep my partner? That's another problem. Will I have the opportunity to work? All those things, and you can't plan them because MG is so fluctuating. I can have a very good day, and tomorrow I have another meeting, and I might have problems to speak. So it's very difficult to explain to people. And I can't but second the other patients and the other representative. We need a change of mind, a change, being more open and not saying before, oh, that's strange. Oh, just don't, how can I say, judge on people before you know all the facts. And that's something I can't but ask, please try to understand this.
Thank you. And thank you for helping us understand, because we need people to come forward to explain. I ask people, do you know MS? Oh, yes, it's quite a severe illness. Well, about 80% of the symptoms are the same for us. With that difference, we have members who are in a wheelchair. We have even members with a gastric tube because they can't swallow themselves. So it's sometimes difficult to go to a restaurant and just eat in company because sometimes I have difficulty to chew and to swallow. So you're staying there with your mom for the food and you get rid of it. So those are things you will see. When our eyelid drop, you will see it. But when someone meets me, nobody will think, oh, she's ill. And that's the difficulty. Yes. And what I want is just recognition. Recognition not only for MG patients, but for a lot of neurological diseases, which are not very visible.
And that's something we should have. And especially for MG patients, I must stop afterwards. I would love to have some rooms to facilitate working for them, because only half of MG patients are working. And from those 50%, nearly 80% are independents, because that is the only way to structure their life and their work. So they can work when they feel well, and they are at home when they can't. So that's something that should change, and not only national, and that's something we have to change in the guidelines. And not only the guidelines of treatment, but also the guidelines to live.
So work, obviously, participation in the work is important.
Which is a return. We need medication, we need treatment, but if we are able to work, we can return.
And we need taxpayers' money. So,
yes,
yeah,
and
exactly.
we will pay for our own treatment, even if we want to go into the innovative treatments.
Thank you so much, Ruth. So last, I will pass over to you, Jean-Philippe. You are, can you explain yourself, which disease groups and who you represent? You could do it better than I can.
Thank you, Astri. Thank you for this kind invitation. I'm very happy to be here representing the European Patient Organization for Dysimmune and Inflammatory Neuropathies. My name is Jean-Philippe Plançon. I'm French, as you can hear. And I'm also the vice president of a rare disease French alliance, which represents 240 patient organizations in France. Then I'm also very involved in EAMDA, which is a year-end dedicated to neuromuscular disorders, which, of course, we know each other because we are in discussions like that. We have the opportunity to work together, not all the time, but as much as we can. So just for you to better understand, I live with a rare disease myself, of course. Sorry, not of course, but I live for 25 years now with a Dysimmune inflammatory neuropathy, which called the Lewis-Sumner syndrome. And just to go deeper, the chronic inflammatory demyelinating polyneuropathy, which lets you know how much the rare disease can be complex, of course. And Dysimmune inflammatory neuropathy are a complex and heterogenic family of disorders, acute and chronic. And if you consider the acute form, probably you know the Guillain-Barré syndrome, which can make die because almost 5 to 7% of people are dying from GBS. And we are talking here about very complex and debilitating disorders. So we talk about the diagnosis and about the early diagnosis. And of course, for all patients, in fact, it's crucial. And if we consider being patients, it's also very important. And if we consider the heterogeneity of countries, it's a problem. It's a problem because within EPODIN, we have different national patient organizations. And we know that if you live in Romania, if you live elsewhere, it can be very difficult and challenging for patients. So at least for the DIN patient community, we know that it's very important to be diagnosed as early as possible because we've got some treatment, not curative treatments, but treatments that enable us to be here today to talk with you, because without this type of treatment, I can't walk, I can't shave myself. It's completely for me to dress myself. So it can be very challenging to live with this type of disorders, like many others, of course, but this one is a montagne russe disease. Then what we can say that unfortunately it's mostly the country who dispose of adequate treatment, and maybe we'll talk about some treatments such as PDMPs, plasma-derived medicinal products, which is very important for us as patients. This is in those countries who have adequate treatments and options that we can have early detection programs. And this is not fair. This is not fair, of course. I can go deeper.
Yes, because so what you're saying, as the others also have pointed out, it's really timely diagnosis, access to timely diagnosis, and then therapies, because
Yes.
many of these are actually being really helped by therapies. Are there other hurdles you see or points you would like to highlight?
Yes, yes. Just about plasma-derived medicinal projects, just for you maybe to better understand what we are talking about. Here we are talking about treatment which is called immunoglobulins. In your blood, in our blood, we've got a lot of proteins in our plasma, and when we are able to fractionate this plasma, you can find some treatments like immunoglobulins for patients like me and like.
And when you say plasma, it's in the blood, huh?
In the blood.
Yeah.
If you give your blood, we can use your red cells, then the plasma in which you can find many interesting proteins, and immunoglobulins are this type of proteins, but there are many others. If we consider the supply chain of plasma, it can be very challenging. To treat a patient like me, for example, you need 380 plasma donation per year. It's a lot, 380 plasma donation, just for one patient. So it's very challenging, and it means that if we consider the supply chain of a plasma collection to the fractionation, which is the industry process, to the patient, it's very challenging and complex. So we had last year, it was in last August, a new regulation, the SO regulation, Substance of Human Origin regulation, which will be implemented in countries in 2027. And we hope, and we advocate for that we emphasize the fact that each country should find the best way to collect more plasma. And if we consider the European level, there is a lack of 5 million liters of plasma. So, and most of the plasma actually that we are using in Europe and in the world is coming from US. And I don't want to go deeper to political issues, but you understand how it can be challenging to have this type of organization. And for patients, it's a real problem.
And I guess here also general awareness in the public, is
yes, I
needed
met some.
For
of
us
course,
to
I
volunteer.
met a lot of MEPs for talking about the SO regulation because there is ethical issues, there is financial issues behind this question. But what's important for us is to stop talking and not to act. I mean, we need 5 million liters of plasma to treat patients. How do we do that? Is it only public sector? Is it between public and private that we need to collaborate? And in some countries it works. So please go further on that.
Okay, thank you for that straightforward call to action. So I think I want to give you all a really warm applause for all your and for taking really the effort and fighting for not just yourself, but for us. It's impressive. And we also think actually it's quite impressive that we have so many MEPs here at the table because, as I said when we started this meeting, it's really appreciated the political interest. We need it. And we want you to understand and have this communication so we can make the best possible decisions, or you can make the best possible decisions to improve this field. So I think we have limited time, as you know, but we have a few minutes for you, both of you, no, for all of you. I guess you have prepared some statements or some things you want to highlight in relation to our topic today. So I think I will start with MEP Tilly Metz.
Yes, was pleasure. Thank you for having me. And I'm really sorry that I could not be there from the beginning on because I would really have loved to listen, but it is registered, no? So I can maybe look at it at another time because hearing about the more general insights from the experts, but also specifically on the Dravet syndrome. My father was a neurologist, worked together with Dr. Dravet, and he was also specialized in an epilepsy syndrome. So I would really have loved to be there. And also thank you very much for the testimonies, because that is really where we learn a lot as politicians. So thank you very much for having the courage also to come here and to speak about your daily life. It's really appreciated. Thank you very much to you. Let me start by saying that also this event is very timely, as next week we will celebrate also the Rare Disease Day, where we have the opportunity to really raise awareness in our countries, in our constituencies. I don't want to talk a lot of time, but I will focus mainly on 3 points here that I want to highlight. First, the European Health Data Space. So I had the pleasure to be shadow rapporteur on this file, following the leadership of my colleague here on my right side, Tomislav Sokol. So the European Health Data Space presents really a unique opportunity to transform care for patients with rare neurological diseases by facilitating really cross-border data sharing, accelerating the so needed diagnosis and also advancing research. Given the fragmentation of healthcare data across Europe, EHDS can provide really a harmonized framework to connect specialized centers and the European reference networks, so ensuring that clinicians and researchers can access crucial insight for faster and more precise diagnosis. So patient registries and natural history studies are vital for rare neurological diseases. Through EHDS, we can strengthen these resources and enable secure access to anonymized, as is important, patient data, supporting the development of targeted therapies and personalized treatments. So, however, the success of the EHDS is really also dependent on a strong governance, so on patient trust and also data protection. So patients must be actively involved also in shaping how their data is used and shared. Second, and that is also reality in Europe, and then I would say in the world, we have a shortage of specialized doctors. So lack of doctors is a major barrier to timely diagnosis and treatment for rare neurological disease patients, and especially on looking at neuropediatrics, where we really have an important shortage of there, but also in general. 80% of patients with rare neurological condition require a condition-specific specialist, yet many face, and you know that better than I, long waiting times, and we have also geographical disparities and a lack of expertise in their local healthcare systems. In Europe at national level, but in a coordinated way, we have to increase funding for training programs in neurology and rare disease specializations, encouraging young medical professional to enter the field. This parliament will start working now on a report on healthcare workforce crisis, and I think this is also a great opportunity to address this challenge that also affects neurological patients. Third, and that is my last point, we need to empower patients and their families. So empowering patients and families is really crucial to ensuring better outcomes and improving the quality of life of those living with rare neurological diseases. The patient perspective and real lived experience should be incorporated into policy development, system design, and care delivery. Any decision affecting patients in this house must be made with the patients. That is why it is essential to ensure that the EU for Health budget remains big, as funding for health advocacy organizations is crucial also for good policy design. The European Parliament must advocate for policies that support greater patient engagement, including increased involvement in research, clinical trials, and also decision-making bodies. Thank you very much, and sorry again that I was not there from the beginning.
Thank you so much. So I hear the data, European health data space, and I hear capacity building in workforce, and I hear patient involvement. So thank you so much. And I hand over to your colleague, Tomislav Sokol.
Thank you very much. Thank you for inviting me. Thank you for coming to the European Parliament to speak about a topic which is one of the most important topics, I think, here when you deal with healthcare, and that's rare diseases, because we hear in a lot of cases that EU does not have a competence to do something in healthcare, that it's only a national thing, etc. But that's definitely not true. And I think there are some areas like rare diseases where EU can specifically provide added value. So because the whole idea of the European Union to solve problems which member states cannot solve by themselves. And I think with rare diseases, that's the best possible examples. And of course, when we speak about rare diseases, they are not that rare. So if you take all of the rare diseases together, we have more than 30 million people suffering from them in Europe. So I think that's a very important issue. That's something that definitely we have to work a lot on. I always like to be concrete, to say what EU can do. And I think so. First, there's the question of research that was already mentioned. We have now the cancer mission in the EU in the Horizon program. We have health as one of the priorities, but I definitely think that rare disease should also be there as one of the priorities to be able to spend more money from EU budget directly on high level research. And I think for rare disease this is particularly important. So I think that's the first thing. Connected with that, EHDS, my colleague Tilly said a lot of this. So I will try not to repeat, but I think EHDS can really be a breakthrough. So first in terms of the so-called primary use of data, that when you go to see a doctor in another hospital, in another town, in another state, that they can access all of your health data much faster, which also means quicker diagnosis, which is one of the things that were mentioned by you as very important. But also in terms of research, I think that the possibilities that we have by using the health data space to use the data from across the European Union to actually do research, to create new medicines, to create new treatments, etc., etc. I think that's enormous. I think that's the biggest game changer. I think that's the biggest breakthrough that we've done actually in the last 5 years here in the European Parliament. Of course, for us, it's important that this data is useful, that it's representative. This is why we went with the so-called opt-out, which makes it possible for patients who do not want their data to be shared for some reason, can decide so, but that we get the data which is useful and representative in the end. So I think that definitely EHDS, when it is implemented in 4 to 6 years' time, because it will be implemented in phases, will definitely create major breakthrough. We have to do whatever we can on EU to support that, to prepare the system, to build trust from patients and healthcare professionals in the system, and for that we'll also need strong funding from EU level. And I think this is something very important. Also, one thing that I think for rare disease is particularly important is cross-border healthcare, because for especially in small member states like in mine, like in Croatia, for a lot of these diseases you just don't have a treatment. So the only choice for you is to go abroad. But if you want to go abroad and get treatment, you need to be a health law expert to know what your rights are and to navigate through all of the procedures and rules on reimbursement and authorization, etc., etc. So I think that we have to change that. I think that we have to simplify those rules that we have on EU level. I think instead of having 2 sets of reimbursement rules, we should have only one. And I think definitely that we should also use European reference networks much stronger than now. Also in terms of fast diagnosis, using ERNs is something that can really make a change, that you get the right diagnosis from best experts across Europe without having to travel to other member states. So I think that's also something particularly important. What we have to do also now on the EU level is to strengthen funding for ERNs. And as you can see, a lot of things that we speak about here are related to funding. And I think generally the most important fight here will be about the budget. So you know that we were able to increase the budget for period 2019 to 2024 by 10 times when compared to 5 years before that. But now we are kind of losing the momentum on health. So we see that there are some other priorities getting more visibility, and I think that we have to fight for health, and I know and I'm certain that my colleagues will also do that. So I think that in terms of funding for research, for innovation, for implementing the health data space, for strengthening ERNs, European reference networks, I think that EU can really do a lot on. Also in terms of better regulation, better access to innovative medicines. I think that's very important. You know that we are still working on the general pharmaceutical legislation. I'm also one of the shadow rapporteurs there. For us, what is crucial is that all medicines can be accessed by all patients, no matter in which member state they live. So that we don't have a situation that for some rare diseases, out of 50 new medicines that were approved by EMA in the last 5 years, 45 are available, for instance, in Germany, while in some Eastern member states only 2 or 3. So this is something that is completely unacceptable. This is something that we have to change. The Parliament's position is clear, so that we need to guarantee access, and we need to impose an obligation on the pharmaceutical companies that when a member state makes a request for a certain medicine, it has to be provided within at least, well, at the most 12 months. So I think this strengthening of access is important. And very last point on SOHO regulation, I agree with you completely. There was a lot of discussion about direct about reimbursement, how to organize reimbursement for plasma. My political group, we took a flexible approach, as you said, so that we have to allow member states to regulate this in the best possible way. Of course, we don't want to create this into some kind of a market where this is paid, etc., and traded. But on the other hand, we also have to make it possible and create incentives for people to donate plasma. And as you said, so currently we are dependent on imports from the US, and this is something that is quite unacceptable. So I agree with your approach completely, and I think that definitely this kind of regulation that we have now, where member states have the right to regulate this as they want, I think that's the best possible way.
Thank you so much. Sorry for interrupting. It's really good that you have so many points, but we have to give also the other ones the word. But thank you. So many good points you bring up, and I'm really happy to hear. I think we are quite agree on what are really important here. So it's just kind of realizing it. That's the problem. So then I will pass over to Margarita de la Pisa Carrion from Spain.
Thank you very much. It's a very pleasure to be here with you this insightful morning. As you see, we are building a great team. Many members, this health patient, and we already have many tools. We have the intergroup of rare and cancer and rare disease. We have the disability also intergroup. We have this interest group. Now we have a committee, subcommittee, that of course they are already trying to tackle the different difficulties that we are facing as the lack of professional, the lack of expertise, and the needs of this interchange of professionals, but also the problem with the accessibility of the medicines with this. So in a way, we are already working in many of the things that you mentioned today, but we are here to hear you, to gather your awareness, and we will try to drive solutions. I would really like to remark 2 points that maybe have not been really mentioned. That it's true that we are now facing in this mandate a challenge times, because the new technologies will allow us for go deeper in new investigation, know better better understanding of the function of the cells, the neurology disease, and I think that we will be able to target to find new therapeutic tools. So I think that Europe have to be pioneer in this career, because of course that we have the better professional, the investigation. So we have to ask for investment to be able to deliver to the society these new hopes, because each new medicine is a new hope. And we have now the technology to go into that. And also that we have been talking about medicines, and we know the difficulties and the difference between the countries, but also there are a lot of difference when we talk about other kind of therapies. As we know, early diagnosis make a big difference, but also early treatment medicine, but also physiotherapy or many other. I think that in the neuropsychology therapies sometimes are even understand as something not into the medical sphere, but means also a lot of investment, and we see a lot of difference in the kids that have this support, especially in early stage, and the ones that have not. And sometimes it's the family members that have to make an effort also to build foundations, societies, to try to give the kids or the patient the environment to fulfill all their needs. So I think that also at European level, we have to give this idea of treatment that is go beyond the medicine as a need, that have to be also an equality between the member states to provide this kind of therapies. I think that we are all agreeing this holistic, but because it's not just it's also a social dimension of the patient. It's not only the patient, it's the family. And I think that we work pretty good in this beating cancer plan strategy that give us an idea that how the politicians and the patient and the doctors and also can work together to bring strategies that can also inspire national strategies and also ask service in the wallet of the member states, the sanitary. Thank you very much.
Thank you.
Thank you very much.
Thank you so much for bringing up those. So really bringing in new technologies, new opportunities, but also the holistic approach to the need for care and support. Thank you so much. So then we have Romana Jerkovic. You were here in our last meeting as well, so welcome back.
Thank you so much. First, I would like to thank to EFNA for bringing us together here today and for giving us opportunity for this fruitful discussion and for their important and continuous work on supporting people with rare neurological diseases. When I was going over the materials in preparing, while preparing for today's discussion, I was really taken back by the data that I found, how many patients wait for their diagnosis, how many patients, how much they are waiting for the treatment. And we had this live testimony for Merete and Lut and Jean-Philippe, and really it touched me, really, because these are not just the statistics. This is the story about the everyday real life and the struggle and the suffering and the frustration. And on the one side, it's very sad, but on the other, it's very motivating for me as a politician. And yeah, we should be worried because these diseases are not getting enough attention as it deserves. And when I say that they lack the attention, I mean they lack in the funding, in the robust research, and of course also in the awareness among not just the general public, but the clinician as well, and so on. So to put it simply, we are not prioritizing those patients and those diseases, and those are not just my words, it's the data say is all. And there are too much burning issues to which we are not yet offering proper solution, and one that is touching me probably the most is the access to treatment. And while patients in the big countries such as Germany and Italy and France, they have access to over, for example, 40 orphan medicines, patients in small countries such as mine, Croatia, have access to only 9. So this is unacceptable, and it sends a completely wrong message that your life as a patient in a small country matters less. The access to life-saving medicine should not depend on geography. And we as a politician must do much more to change these things. So at the end, just to the patients and their families, I would say that I want you to know that your stories and experiences inspire me, and I was listening to you, and you can count on my support as vice chair in the SUN committee. I will do all my best that this topic become and remain priority for our SUN committee. Thank you so much.
Thank you. It's really a key point, prioritization, that it deserves. I think really what this summarized to me is that we agree on many of really important, relevant points. And I think you said it so nicely now to the end then, that this is about priority. And I can't understand why we are not prioritized more, honestly. I struggle to understand why cancer and cardiovascular and diabetes, all other diseases get the attention they deserve. It's not that they don't deserve it, but why don't we do the same? It doesn't make sense to me. And I think it has something to do maybe with what we reveal in our survey about the invisible aspects of it. and where actually half of the respondents tell them that they feel that they are blamed for their disease, which to me is strange, but it's a reality that people experience. So thank you so much again for being here, all of you, and thank you so much for showing, not hiding, because we need to stop hide. Too many of us have been too hidden for too long. So this is needed. So the hard work is just going on, but we are building a good team, as you said. And we actually have a little bit of time for a coffee and a snack or a cake behind us here to network a little bit towards the end of this meeting, because we have to be out of the room at 12, the latest, because other people are going to use it. So thank you again so much.